Welcome to Raaonline. Today's case for today's discussion goes as follows. A young boy, 6 years old, was rushed to the hospital ER with complaints of fresh bleeding from the nose, which could not be stopped. Parents gave history of nose picking habit in the boy, and he also had the habit of inserting pencils sometime into his nostrils. Identify the clinical condition, name the area of bleed, name the arteries anastomosing here, name the vascular plexus formed here, what is the domestic remedy for this condition, what are the other causes for the condition. So it is a case of epistaxis. So with a case of epistaxis, we are going to discuss about the anatomy of nose and exactly where this case will fit into. For anatomy questions, you will be also asked to describe the structure in detail, the blood supply, the nerve supply, the lateral wall, the septum, okay, because it is an essay question. Okay, let's start with the objectives of this session. Students should be able to describe the bones and cartilages forming the nasal septum, bones and cartilages forming the lateral wall of the nose, the turbinates, concha and metatarsus of the lateral wall of the nose, the blood supply, the lymphatic drainage, the innervation of septum and lateral wall of the nose, the clinical anatomy of septum and lateral wall. At the beginning of the session, I want to clearly tell you students that this is our essay question chapter. So the essay question mostly will be asked with the lateral wall of the nose. And also it is a very important short note, and especially the case has been given to you. At that point you should know that it is being talked about the Kesselbach's plexus, which is present in the septum of the nose, and epistaxis is very common from these plexuses. Now coming to the external nose, anatomy of nose. So you can see that the nose is a pyramidal projection on the face, and it has a root, it has a tip, it has lateral wall, or the ala of the nose is present. Whatever is visible you are having. This is called the dorsum of the nose, and there is a side of the nose, and the openings, the external layers, are also called the nostrils. So we have the nostrils. So this is mainly a pyramidal projection, very commonly injured part of the body also, because it is projecting out from the face. So nasal fractures are also very common. Coming to the nasal cavity, the anatomy aspect. So the interior of the nose will be divided into two nasal cavity, because you have the two nasal nostrils which will extend inside as the two nasal cavities. So it extends from the anterior nares to the face, from the face to the posterior choana in the nasopharynx. So if you observe that this is the nostril or the anterior nares, and it will enter like this, and this will be the lateral wall, and where it ends is the posterior aspect, posterior nares or the choana, what we are calling the choana, and from the choana you will get the nasopharynx. So exactly the nasopharynx will start. So nasal cavity will have two subdivisions. You have a vestibule, that is the anterior inferior part of the nasal cavity is also called the vestibule. So this part is called the vestibule, and it is lined by skin. And the nasal cavity proper, which is the large posterior superior part of this cavity, which will be lined with the respiratory mucosa, that is the respiratory epithelium will be present in the mucosa, and that is the nasal cavity proper. So coming to the vestibule of the nose, so if you concentrate on the vestibule, that is the anterior part which has hairs, it is lined by, that is the ala of the nose, the inner aspect of the ala of the nose, and it is having hair follicles, and you have skin over here, you have sebaceous glands, you have hair follicles, you have vibrissae, and you have a lateral upper limit which is called the lumen nasi. So this is the upper limit which is called the lumen nasi. Medially it will be actually the most anterior part of the septum, and it is a fold of skin which is in the center. Just above the philtrum you are having the columella. So the medially you have the columella. So coming to the nasal cavity proper, it will be divided into two by the nasal septum. It is pyramidal in shape. So the nasal cavity is pyramidal in shape. It has a roof, it has a floor. So you have a roof for the nasal cavity, you have a floor for the nasal cavity. It has a medial wall, that is the septum. and it has a lateral wall also. So lateral wall is also present. So vestibule is over. So anterior inferior part, it is a smaller part, and then the posterior superior part is the nasal cavity proper. From anterior to posterior, you will have the olfactory region, the upper 1/3 of the nasal cavity in the roof. You have the olfactory region, and the respiratory region, the rest of the nasal cavity is the respiratory region. Now, we are dividing it into 3 parts. That is the anterior sloping part. The roof is divided into 3 parts basically. The anterior sloping part, you have the nasal bone. So, you can see over here, this is the nasal bone, this pink colored structure. The frontal process is also present. Okay, the frontal process of maxilla. Okay, so that will come over here, and the nasal spine is also there. Okay, of the frontal bone. So, nasal spine of the frontal bone, maxilla is over here inside. So, nasal spine. Now, coming to the middle part of the roof. So, this is the frontal bone, the frontal sinus is present here. So, this is the middle part of the roof. You will have the cribriform plate. So, this is the cribriform plate of ethmoid, which is pierced by the olfactory nerve filaments. So, lot of filaments are piercing it, which is called the olfactory nerve filaments. So, cribriform plate. Then we have the posterior sloping part. So, posterior sloping part, which is the undersurface of the sphenoid. So, this is the sphenoid over here, and undersurface of the sphenoid, this is the posterior sloping part. So, if we see, there are 3 parts in the roof. So, you have the anterior sloping part, which has the nasal bone, the middle portion, which is mainly formed by the ethmoid. This is the cribriform plate of the ethmoid. So, you can see that this green color is nothing but the ethmoid. Okay, and then the posterior sloping color, this becomes the sphenoid bone. So, this is the sphenoid. So, these are the 3 parts of the roof of the nasal cavity.